Sanitizing my hands. Hello, my name is Zach Fry. I'm a student PTO at Penn State Hazleton. Is it okay if I be working with you today?
Yes.
Can you please tell me your name and date of birth?
Bobby Schaefer, April 7, 2005.
Do you know where you're at today?
Penn State Hazleton.
What year is it?
2025.
Perfect. So today we are going to be doing some exercises. I see that you have a C6 level injury to your spinal cord.
Yeah.
Do you have any pain with that today? On a scale of 0 to 10, 0 being no pain, 10 being you need to go to the hospital?
Nope.
No pain?
0 out of 10.
Is this injury, how's your activities in your daily life with this injury?
Pretty challenging.
Pretty challenging?
Yeah.
Kind of like, so when I say that, how's like brushing your teeth and like trying to get into a car, how's that?
Pretty hard. Yeah, it's been affected.
Yeah?
Yeah.
So prior to this injury, would you say you were independent?
Yes.
And now you probably say you're dependent.
I would say
you
I'm
rely
dependent.
on someone at home with you.
Yep.
All right. Do you have any goals that you want to get back to with physical therapy?
Just try to become as functional as possible.
It's a good goal. What were you doing for work before this?
I was a professional football player.
No way. What team?
The Philadelphia Eagles, baby.
All right. Cool.
Thanks, man.
So now I'm just going to do a quick explanation of the treatment and then a couple like expectations.
Okay.
So since you have a spinal cord injury, in case you didn't know, we like to really challenge our patients. We do high intensity workouts. With that, you might be sore in the next coming days.
Okay.
Try not to let that affect you too much.
Okay.
But next treatment, I want you to come in and let me know if you were sore, how sore you are, where it's at, kind of all those things.
Okay.
Let me know if you feel any pain throughout this treatment.
Okay.
If you feel pain, we will stop. If you feel fatigued, we'll rest. If you feel any abnormal sensations like numbness, tingling, pricklingness, just let me know as well.
Okay.
We'll try and take care of that.
Sure.
So the benefits of high intensity working out, and especially in the position that we're going to get you in. So we're going to get you into a prone on elbows position. That's going to help improve your upper trunk and upper extremity strength, because I see that since it's your C6, you still have some shoulder function, you still have your neck. So we're going to really try and work those muscles out to really improve that.
Okay.
Like I said, we're just going to be weight bearing through that shoulder and trying to increase your range of motion at your neck area.
Okay.
And we're going to widen your base of support, your center of mass, and we're going to make sure that you're safe throughout these treatments so that you can also do them at home while you're in bed. And it seems to be good. All right, so before we do anything, I'm just gonna put this gait belt on you. We just do this so that I don't have to grab onto any of your clothing. If it's all right, I know you can't really lean too much, but I'm gonna have you lean forward a little bit. All right, good. I'm gonna try and make sure it's not too tight, since I know you don't have too much sensation in the trunk. That looks good. I should be able to get a good grip. All right. Now this is just used for balance and functionality for me to grab onto you. It'll help me transfer you as well.
Okay.
We're gonna be using a sliding board. Now, before we begin, I'm gonna do a quick skin inspection of some of the areas that have been affected. So looks like your shoulder is good, your forearms are good. I'm gonna take a look at your hands, looking good. Good at the hips, knees, your ankles are good. I'm gonna check more when you're in prone, because when you're in prone, some of the areas that are more susceptible to ulcers and pressure, they're checked a lot easier while you're in prone.
Cool.
Alright. This is the sliding board. This is how we're going to be moving you from the wheelchair to the mat.
Okay.
Before we do that, goniometry.
Okay.
We're going to be measuring your cervical flexion. So I'm going to test your right side.
Okay. Wait, we might want to move forward a little bit. Okay. Okay.
All right. My fulcrum is C7. My distal arm is in line with the occipital protuberance, and we're going back. Now you can go ahead and move to your right. Realigning. All right. Looks like you got about 40 degrees there, which is right around normal. It's a little bit under, but we're gonna work on it. All right. You ready to get onto the mat?
Yep.
All right. Sounds good to me. All right, so I'm gonna pull onto your gait belt here. I'm gonna take this armrest off.
Okay.
It's just to help make it a little bit easier. We don't want to bang anything. Now I'm gonna slide this under your tush.
Okay.
So I'm gonna scoot you. I'm gonna get this underneath. All right. Now I want you to try and place your elbow onto the board for me. And on the count of 3, I'm gonna scoot you just to get your butt a little bit more on the board.
Okay.
Then we're gonna move the elbow over here. Try not to get pinched by the board.
Okay.
All right, ready?
Yep.
3, 2, 1. All right. Readjust the elbow here. 3, 2, 1. All right. And one more. Elbow on the mat. 3, 2, 1. All right. How'd that feel?
Good.
Feeling all right?
Yep.
All right. I'm gonna swing you onto your side. Okay.
Okay.
All right. And we'll adjust your legs. Keep them straight. All right. That seems a little loose, but we're gonna get all right.
Okay.
All right. Now we're gonna get you in the prone. So I want you to do is try and get your arms up in this position and start swinging yourself from side to side. And all right, and turn 3, 2, 1. All right. I would have crossed his feet beforehand, but he's a little impulsive. Sorry, you're good. Sorry. All right, now I'm gonna get on the table with you.
All right.
I'm gonna check your skin. His shoulders are inspected, back, but your hips, hamstrings are good, knees, ankles. His skin is clear. All right. Now what I want you to do is dig through the mat table with your elbows and try and get into like a Superman position. Oh yeah. Perfect. How you feel? Cool. All right. So the first exercise that we're going to do are some scapular push-ups with his elbows.
Okay.
So you're gonna push down, push up. I'm gonna be applying a little bit of manual resistance throughout this. We're gonna do 3 sets of 10, okay?
Okay.
Ready?
Yep.
So you can go down. 1, 2, 10. All right. Now, did you have any pain with that?
No.
All right. Are you fatigued at all?
No.
Did you feel like that was a good challenge?
Yes, I feel worked out.
All right, great. Glad to hear. Next, we're going to do prone on elbow, a little bit of ambulation on the table. We're going to be working from the left side to the right side, and we're going to work on just some bed mobility type things with this TheraBand to increase the intensity. All right, so I'm going to slip this on here. All right. Now what I want you to do is move basically on your elbows towards me. And you can go from the left to the right. We're going to do this 3 times from the left to the right side of the table.
I did 3 times.
All right. How do you feel with that? Any pain?
No.
Any fatigue?
No.
And did that feel like a good workout?
Yes.
Are you tired at all?
No. Feel good.
No, you feel good.
Yes, sir.
All right. All right. now that we've done that,
Right side, okay. So I'm just gonna be right behind you.
now for my patient, we're not going to be using any bracing just because it could get in the way of his function. But now I would state that he would be using bracing in certain areas, but he is not for this current situation. All right.
Towards your shoulders to the right side.
Now we're going to get you back onto a sideline position. So you can go ahead and, what you're going to do is you're going to dip your left shoulder here.
From there, it's 45.
So instead of doing like that, yep.
Oh, my phone.
And you're gonna push through your right shoulder.
Yep.
And we're gonna cross your feet. And now what I want you to do is try and reach with your right arm all the way to the knee. Good. All right. Now we're gonna adjust you towards the middle of the table so that we can roll you a little bit easier.
So
Good.
we're doing it. I'm just gonna put the statement on.
Okay. One more time. Now we're gonna do that momentum thing again, but we're gonna roll towards me. We're gonna stay in a sideline position.
Okay.
And then we're gonna sit you up and get you back into the wheelchair.
Sure thing.
All right. So 1,
1,
2,
2, 3.
All right. Now try and use that right arm of yours and dig up through the table. All right. I'm gonna swing your legs up. Smooth and effortless.
Beautiful.
All right. Get this under your tush again. All right. Now put your elbow right here. Ready? And we're gonna do the same way we got into the chair.
Okay.
Or out of the chair. 1, 2, 3. Now readjust that elbow. 1, 2, 3. All right. How you feeling?
All right, so I want you to use
Good.
primarily your elbows.
Get this back on there.
So what we're gonna be doing then is just slide this.
And then I would put the leg rest back on. Now,
Sit on top of it.
I forgot to mention this earlier, but I saw that you had diabetes mellitus
Actually, just-
and that you've been taking Jardians.
Just gonna move that.
Did you eat anything before this treatment today?
I did.
Okay. And because of Jardians, did you have any dizziness throughout this?
Nope, that was good.
Feeling good? All right. How about pain ratio?
Okay. No pain.
No pain?
Nope.
Now I'm reassessing skin. Skin looks good. Everything looks good. Can you show me that range of motion one more time? Do you right? Perfect. All right, so now we are going to just take you through a bit of range of motion.
Okay.
Yeah.
And then one
Go
more.
through the shoulder, elbow, check the wrist, fingers, check the side,
Yeah, good. And then I'm
flexion,
just gonna have you use your elbows to
extension,
just show yourself on that.
hips, extension,
Much better.
check the foot.
All right, so I do want to try some exercise while you're in this bit.
All right,
Um,
looking good.
so I do want you to
And
use
while you're in the
push-ups,
wheelchair, when you're at home,
using your,
just make sure that you're moving about every 15 minutes if you're in the wheelchair. And if you're in bed, try to reposition yourself every 2 hours to prevent pressure ulcers or pressure wounds.
And then we're
All right. When you're at home, you can do those same arm ambulations across the table. I'll be sending you home with the TheraBand. When you do the elbow push-ups, you can just have someone at home. Do you have someone at home with you right now? You can have them push down on you so that they can apply that manual resistance. Or you could even use like a plate in the gym. You can have someone place it on your back for you. When you do that, you'll do that 2 times a day. You'll do it 3 sets, 10 reps.
Okay.
And then you'll do it every other day.
Gotcha.
Okay?
Gotcha.
I think that's everything. Do you have any questions for me?
Nope.
All right. Thank you for letting me work with you.
Well,
I will wash my hands now.
All right.